Hello everyone. So today we would start the topic of topography of head. We would have a brief introduction about it, borders between the head and neck, borders between the cerebral and facial department. So borders between the head and neck. If we draw a line from the following anatomical structures to separate the neck and head, which are these anatomical structures? First is the mental protuberance. First is the mental protuberance. Then is the inferior angle of mandible. Okay, inferior margin of mandible and inferior angle of mandible. Next is the mastoid process. Fourth is the mastoid process, which is behind the ear. Posterior margin of the mastoid process and superior nuchal line. See, you can see in this structure, boundaries of the head and neck, this is the superior nuchal line. And next is the external occipital protuberance. This is the external occipital protuberance. So these are the borders between the head and neck. Now next is the borders between the cerebral and facial department. If we draw a line from the following anatomical structures, like zygomatic process of the frontal bone. This is the zygomatic process of the frontal bone. Frontal process of the zygomatic bone. Both the processes are of the same region. What is the difference? Zygomatic process of the frontal bone. This is the frontal bone. So, zygomatic process of this frontal bone. And frontal process, this is the frontal process of which bone? Zygomatic bone. And another is zygomatic arc. Now, fourth one is the external acoustic meatus, which is here, external acoustic meatus. Anterior margin of the mastoid process and apex of the mastoid process. See, this is the mastoid part, anterior region and apex of the mastoid process. Now the cerebral department is divided into three regions. What are those? Frontoparietal occipital region, temporal region and mastoid region. Now we further go through these three regions. Okay. Now topography of fronto-parieto-occipital region. Now what are the borders of this region? First is anterior. In this anterior border, we constitute glabella, which is here. Glabella, superior orbital margin and frontal bone. Supra-orbital margin and this frontal bone. This is the anterior margin. Now what is the posterior margin? Posterior margin is superior nuchal line and external occipital protuberance. And bilaterally, there are superior temporal lines. Now, next is the layers. What are the layers of this frontoparieto-occipital region? First is the skin, which is covered by hair and it is strengthened by galla aponeurotica. Okay, it is covered by hair. The skin is covered by hair and it is strengthened by galla aponeurotica. Now, second is subcutaneous tissue. Now, subcutaneous tissue, there are nerve subcutaneous vessels like supraorbital, frontal, superficial and temporal artery, posterior auricular and artery, posterior auricular artery and vessels and occipital artery and vessels. Okay. And it also has fibrous septa. This subcutaneous tissue also has fibrous septa. Now another layer, which is superficial layer. Now this superficial layer, it connects with galla aponeurotica. Now this galla aponeurotica, it forms the skin. Now this superficial fascia connects with it. Now it covers the frontal belly of epicranial muscle. Okay, epicranial muscle, epicranial aponeurosis, occipital belly of epicranium muscle. Now fourth is subaponeurotic fatty tissue. There is nothing in this. It is very thin and each border corresponds to its region. Now fifth is periosteum. What is periosteum? It is loosely connected to the bone and tightly connected with sutures of the skull, and it also contains the fatty tissue. Now if it is important, if hemorrhage occur, then it spreads in all the layers and it shows according to this hemorrhages, according to the region, it would define in which region the damage is there. Now bones. The bones are paired and unpaired. Okay. What are unpaired bones? Frontal and occipital, and paired is parietal. Now each bone, there consists 3 layers: external lamina, dipole, which has veins, and internal lamina. Okay. Now next is the topography of the temporal region of the head. Now anteriorly, the temporal region has zygomatic process of the frontal bone and frontal process of the zygomatic bone. This is the anterior border. Superiorly, there is temporal line, and inferiorly, there is zygomatic arc. Okay. Now layers. Now the first layer is skin. Okay. This it is thin, movable, lots of sweat glands are there. Okay. And sebaceous glands. Okay. I'm sorry. Sebaceous glands are there. Okay, now which are the nerves which cover this layer of temporal region near the skin? Nerve is auriculotemporal nerve, zygomaticotemporal nerve. Now this auriculotemporal nerve, it is a branch of mandibular nerve, which is a division of trigeminal nerve. Okay, and the zygomaticotemporal is also a branch of maxillary division of trigeminal nerve. Now in trigeminal there are 2 divisions. There are occipital division, mandible, maxillary, we will see further. But auriculotemporal nerve is a branch of mandibular division, and zygomaticotemporal is a branch of maxillary division. Next is the subcutaneous tissue. Now subcutaneous tissue is thin and contains superficial temporal artery and cutaneous nerve. Okay. Third is the superficial fascia. Superficial fascia is continuation of gallapa neurotica. We also have seen in that frontoparieto-occipital region. Superficial fascia is also continuation of gallapa neurotica and connects with the and this temporal region, superficial fascia, it also continues with gallapa neurotica and connects with superior temporal line. Next is the deep fascia, which is also known as temporal aponeurosis, and which is tightly connected with the temporal muscle. Okay. Now, this temporal aponeurosis, there is inferior part. Okay. This inferior part of temporal aponeurosis, it is divided into 2 lamina. Now this 2 lamina, there is external and internal division. Now between this external and internal lamina, there is intra-aponeurotic fatty space. Okay. And this 2 lamina connects with zygomatic arc. I will repeat again. Deep fascia of the temporal region is also known as temporal aponeurosis, which is tightly connected to the temporal muscle. Now, the inferior part of this temporal aponeurosis is divided into 2 lamina, external and internal. Between this external and internal, there is intra-aponeurotic fatty tissue. Okay, and this 2 lamina, which is divided internally and externally, are connected to the zygomatic arc. Now, muscles. Muscles are connected with tendons to the coronoid process of mandible. Now, arteries are anterior and posterior branch of deep temporal artery, and nerve is mandibular division of trigeminal nerve. 6th is periosteum, and 7th is bone. Bone, which consists of external and internal lamina. Now next is topography of the mastoid region. Topography of mastoid region, borders are, and it's very simple, anterior and posterior margin of mastoid process, and superiorly continuation of zygomatic arch. Now layers, it is skin, it is very thin and movable, lots of sweat and sebaceous glands are there. Nerve is greater auricular and lesser occipital nerve. When I would teach ENT, in that part also I would teach like which nerves are innervated where. But keep remember, mastoid region, skin, nerve is greater auricular nerve and lesser occipital nerve, which comes from cervical plexus. Okay. Now subcutaneous tissue, it is thin, same as skin, and innervations vessels are post-auricular artery and vein, occipital artery and vein, and post-auricular lymph nodes. Superficial fascia, there is nothing to say about it, but the layer is present. The deep fascia, it is tightly connected with the skull and covers sternocleidomastoid muscle. Deep fascia of the temporal region, it covers sternocleidomastoid muscle. Now the bone. Mastoid process of the temporal bone is compact and contains cellular mastoid. Okay. Now next is important Shippo's triangle. Now what is this Shippo's triangle? It contains antrum mastoidium and connects with tympanic cavity. Okay. Now how it is divided? Superior wall, which is divided by bone with middle cranial fossa. Medial wall, there is prominent canalis semicircularis lateralis, and posterior wall, there is sigmoid sinus. Now borders of this Shippo's triangle. Anteriorly, there is posterior margin of external accutis and spina suprameatica. Posteriorly, there is mastoid crest, which is crista mastoide, and superiorly, continuation of zygomatic arch. See, in this diagram, I have shown it very well. This is spina suprameatica. This is linea temporalis. This is projection of the sigmoid sinus. This is cellulae mastoidium and projection of facial nerve. So, by this diagram, you need to remember what is Shippo's triangle, where it is located, what are the superior wall, medial wall, posterior wall, and borders of the Shippo's triangle. Okay. Now next is meninges of the brain. Layers. What are the layers of this meninges? We are being studying this since our schooling days, like meninges, what are layers of it, dura mater, arachnoid matter, and pia matter. Okay. Now this dura mater is thick, dense and fibrous. Arachnoid matter is delicate membrane and vascular. Delicate and vascular membrane is pia matter. Now we move on to the structures. Structures of dura mater is also known as pachymenix. Okay, which is divided into two, external and internal. External is called as periosteal layer and internal is called as meningeal layer. Now this meningeal layer continues to the spinal dura mater at the foramen magnum. Okay. Now dura mater sends four processes inside the skull cavity. Which are these four processes? First is falx cerebri, second is tentorum cerebelli, falx cerebelli, and diaphragm sella. Now this falx cerebri, it is attached to the margin of sulcus sinus. See, this is falx cerebri. Okay. Now this is attached to the sulcus sinus sagittalis superior. Superior inferior sagittal sinus lies on it. When I will tell you about the sinuses of the brain, I will show you where is the superior sagittal sinus, where is inferior sagittal sinus. You should know which part of dura mater, which process of the dura mater comes under this sinus. Now under sulcus sinus sagittalis superior, where the falx cerebri is attached, two sinuses come, superior and inferior sagittal sinus. Next is tentorum cerebelli. Tentorum cerebelli is attached to the margin of the sinus sulcus transverse. Now superior surface of cerebellum supports the occipital lobes of the brain. Okay. Now tentorum cerebelli is attached to the margin of sinus sulcus transverse. See, It covers the superior surface of cerebellum and it supports the occipital lobe of the brain. Now, the third one is falx cerebelli. Falx cerebelli lies midline. Okay, it lies midline along the crista occipitalis interna. Now, the last is diaphragma sella. Now, this diaphragma sella, it covers the sella turcica and covers the hypophysis. Now, next layer is arachnoid matter. Arachnoid matter is not fixed to the any sulci. It covers the cranial and spinal nerve in the loose sheath. Next is the pia mater. Pia mater deeps all into the sulci and fissures of the brains and contains blood vessels and vascular plexuses. Now, pia mater is incomplete. Where? Incomplete membrane, since there are three openings. Which are those? Magendie's and Luschka foramen, and forms tela chordae of third and fourth ventricles. See, this is foramen Magendie, this is foramen of Luschka. Here it is incomplete and forms tela chordae of third and fourth ventricle. This is third ventricle and fourth ventricle. It forms tela chordae of third and fourth ventricle. Now next is the intermeningeal spaces. Now what are the spaces between these meninges? First is the epidural space, which is also called as peridural, which is also called as extradural space. Second is the subdural space. And third one is subarachnoid space, which is also called as leptomeningeal spaces. Now this epidural space or peridural or extradural space, which is between skull and dura mater. Okay. In this space, epidural hematomas are revealed. What are revealed? Epidural hematomas are revealed. Now, if we give anesthesia, during anesthesia in this region, drugs do not penetrate medulla oblongata and thus respiratory functions are preserved. Next is subdural spaces between dura mater and arachnoid mater. This space is between dura mater and arachnoid mater. Connects with subdural spaces. Now, subarachnoid spaces or leptomeningeal spaces. The subarachnoid spaces or leptomeningeal spaces is between arachnoid mater and pia mater, which also connects with subarachnoid spaces in the spinal cord and ventricles of the brain, and which is reservoir of CSF. Now, this reservoir of CSF, which is also known as cisternae, or cisternae. Now, this cisternae, there are types of cisternae, which is called as cerebromedullary, interpeduncular, chiasmatic and lateral sulcus. These are 4 types of cisternae. Now, next is sinuses of dura mater. It is very good topic because you need to understand, you need to remember, you need to imagine the things. You don't just need to mug up it. Okay. Now this dura mater contains several reservoirs which collects blood from the brain. Now this is also known as sinuses of dura mater. These sinuses are venous canal which are devoid of valve. Now this wall, this has a stretched layer. This walls has a stretched layer due to which it can flexibly stretch and do not collapse even after cutting or injury. Now there are paired and unpaired sinuses. Which are paired sinuses and unpaired? I have marked here in different color. Paired sinuses are in red color and unpaired sinuses are in yellow color. Now these paired sinuses are superior petrosal sinus. See, paired sinuses, there are 2. Superior petrosal sinus and here also superior petrosal sinus. Next is inferior petrosal sinus. Inferior petrosal sinus, and from that side also. This structure is only from one side. See here in the below structure I could show you. From here also and from here also. There are 2 sides, right? So like this only. Inferior petrosal sinus and superior petrosal sinus. These are paired. Next is transverse sinus. Transverse sinus. Sigmoid sinus, cavernous sinus, and sphenoparietal sinus. I have written here in this diagram. Sphenoparietal sinus. So come again. Which are the paired one? Superior inferior petrosal sinus, transverse sinus, sigmoid sinus, cavernous sinus, and sphenoparietal sinus. Now which are the unpaired? Unpaired are superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, and anterior and posterior intercavernous sinus. Okay, once again, superior and inferior sagittal sinus, straight sinus, occipital sinus, anterior and posterior intercavernous sinus. Now how does it work? See, superior sagittal, just wait a minute, I would erase this so it would be easy. Now how does it flow? Superior sagittal sinus, inferior sagittal sinus, it comes straight sinus, superior sagittal sinus come to the transverse sinus. Now this, it further moves to superior petrosal sinus. Okay, this comes here, superior petrosal sinus, it meets to cavernous sinus. Okay, now this comes under occipital sinus, straight sinus, behind there is occipital sinus, then comes sigmoid sinus. Okay, this sigmoid sinus is also connected further to inferior petrosal sinus. From here, and there is also intercavernous sinus, anterior and posterior between this cavernous sinuses. So once again, briefly I would go through paired and unpaired. Paired is petrosal sinus. Which petrosal sinus? Superior, inferior. Petrosal sinus, transverse sinus, sigmoid sinus, cavernous sinus, and sphenoparietal. It is very easy. Petrosal, superior, inferior, transverse, sigmoid, cavernous, and sphenoparietal. And unpaired is superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior and posterior intercavernous sinuses. Now next is topography of the cranial fossa. Now there are three: anterior, middle, and posterior. Now anterior cranial fossa, the borders are anteriorly frontal bone. See, this is the frontal bone. Anteriorly frontal bone. Posteriorly free posterior border of lesser wing. Okay. Free posterior border of lesser wing of sphenoid bone, anterior clinoid process, and anterior margin of sulcus chiasmatica. And both sides is also frontal bone. Anteriorly frontal bone, both side also frontal bone, and posteriorly, see, this is the lesser wing of sphenoid bone, anterior process of clinoid process, and sulcus, anterior margin of sulcus chiasmatica. Okay. Now floor. What is the floor of this anterior cranial fossa? In the median plane, there is cribriform plate of the ethmoid bone. See, there is cribriform plate of ethmoid bone anteriorly in the median plane. Posteriorly, superior surface of anterior part of sphenoid. Superior surface of anterior part of sphenoid. This posteriorly. On each side, orbital plate of the frontal bone. On each side, anteriorly orbital plate of frontal bone, and posteriorly lesser wing of sphenoid bone. This is the floor. Again, I would repeat it again. Floor in median plane. It is anterior and posterior. Anteriorly it is cribriform plate, and posteriorly superior surface of anterior part of sphenoid bone. on each side. This is anterior and posterior of the median plane. On each side of the floor, anteriorly there is orbital plate of frontal bone and posteriorly lesser wing of sphenoid bone. Now, till here I hope it is understood. Okay. Now what are the other features? Now the scribriform plate of the anterior cranial fossa, it separates the anterior cranial fossa from the nasal cavity. The scribriform plate, it separates anterior cranial fossa from the nasal cavity. Now jugulum sphenoidae. Jugulum sphenoidae, it separates anterior cranial fossa from the sphenoidal sinus. Jugum sphenoidae, it separates anterior cranial fossa by what? Sphenoidal sinus. And the orbital plate of frontal bone, this is orbital plate of frontal bone, it separates anterior cranial fossa from the orbit. Now, what are the attachment? The attachments are falx cerebri is attached at the crista galli. See, this is the crista galli. Wait. This is crista galli where the falx cerebri is attached. The free margin of tentorium cerebri is attached to the anterior clinoid process. This is anterior clinoid process where free margin of tentorium cerebri is attached. Crista galli, falx cerebri and clinoid process, anterior clinoid process, tentorium cerebri is attached. Now, the orbital surface of the frontal bone supports the frontal lobe of the brain. And what is clinical importance? What is the clinical importance of this anterior cranial fossa? If there is fracture of this anterior bone, anterior frontal bone, if there is fracture, it may cause bleed and discharge of the cerebrospinal fluid through the nose. And if there is any injury, then the blood may come into the eyelids. Because of this, there would be black eye appearance. Now, all this was about anterior cranial fossa. Now, what about middle cranial fossa? Middle cranial fossa, it comes from here like this. Now, this is middle cranial fossa. Borders are anterior, posterior and lateral. Now, there are structures in this anterior, posterior and lateral. Now, what is anteriorly? The posterior border of lesser wing of sphenoid bone, anterior clinoid process and anterior margin of sulcus chiasmatica. These are anterior borders. Okay, I would change the color so it would be easy to remember. What is posterior border? Posteriorly, superior border of the petrous part of the temporal bone. Okay, superior border of petrous part of the temporal bone and dorsum sella of the sphenoid bone. Now, what is dorsum sella of the sphenoid bone? This is the posterior part. And what is the lateral part? Lateral part, there is greater wings of the sphenoid bone, okay, anterior inferior angle of the parietal bone and squamous part of the temporal bone. It is very simple. Greater wings of the sphenoid bone, anterior inferior angle of the parietal bone and squamous part of the temporal bone. Now, what is the floor? What is the floor of this middle cranial fossa? The median plane, that is body of the sphenoid bone. Okay, body of the sphenoid bone, middle median plane, and on each side there is squamous part of the temporal bone and anterior surface of the petrous part of the temporal bone. Floor, median plane, body of sphenoid bone, and on each side squamous part of temporal bone and anterior surface of petrous part of temporal bone. Now what are the other features? There are few openings in this middle cranial fossa. Which are those? Now there is an optic groove. Okay, there is an optic groove which is near the sulcus chiasmata, which transmit optic nerve to the optic canal. From there the optic nerve reaches to the optic orbit. See, it passes through the optic canal. This optic groove, which is called as sulcus chiasmatica. Now, tuberculum sella. Tuberculum sella, it separates the optic groove from the hypophyseal fossa. Okay, and superior orbital fissure. Here it is, superior orbital fissure. It is opens anteriorly to the orbit. Now, 3, optic groove. Optic groove transmit optic nerve through the optic nerve to the optic canal. From there the optic nerve reaches the optic orbit. Now, tuberculum sella, it separates the optic groove from the hypophyseal fossa, and superior orbital fissure opens anterior to the anterior to the orbit. Now, on the greater wings of the sphenoid bone, there are few foramen. First is the foramen rotundum. Here is the foramen rotundum, which opens anteriorly to the pterygopalantine fossa. Then there is foramen ovale. This ovale opens inferiorly to the infratemporal fossa, and foramen spinosum. It is very small. Opens inferiorly to the infratemporal fossa. Now, on the anterior surface of petrous part of the temporal bone, there are few openings like hiatus and grooves of the greater petrosal nerve. Where it is? Foramen lacerum. See, this is foramen lacerum, where the greater petrosal nerve opens. Now, lesser petrosal nerve opens in the foramen ovale itself. Lesser petrosal nerve opens into the foramen ovale itself. Now, this middle cranial fossa supports the temporal lobe of the brain, and hypophyseal fossa supports the hypophysis cerebri. Now, what is the clinical features of this middle cranial fossa? If there is bleeding and discharge, the cerebrospinal fluid comes through ear. Okay. Also, bleeding through the nose and mouth if sphenoid bone is involved. Now, if the facial and vestibulocochlear nerves are damaged, then fracture occurs through internal acoustic meatus. If there is fracture of the internal acoustic meatus, then the facial and vestibulocochlear nerves are damaged. If the semicircular canal is damaged, then vertigo can occur. Semicircular canal. In this, there are 4 types. If there is bleeding and discharge of cerebrospinal fluid through ear. If there is sphenoid bone involved, then bleeding through nose and mouth is there. If the internal acoustic meatus is damaged or fractured, then the facial and vestibulocochlear nerve may be damaged. And semicircular canal is damaged, then vertigo can occur. Now, the topography of posterior canal. Posterior canal, the anterior is superior border of the petrous temporal bone. Superior border of petrous temporal bone. On both sides, there is mastoid process of the temporal bone, mastoid angle of the parietal bone, and posteriorly there is squamous part of the occipital bone. Okay, these are the borders. Anteriorly, superior border of the petrous temporal bone. Both sides there is mastoid process of the temporal bone and mastoid angle of the parietal bone, and posteriorly squamous part of the occipital bone. Now, what is the floor? Floor, median plane. In the median plane, anteriorly there is clevus. Anteriorly there is clevus. Posteriorly, squamous part of the occipital bone. Squamous part of the occipital bone. And medially there is foramen magnum. Okay, there are three parts: anterior, medial, posterior. Anteriorly there is clevus, medially there is foramen magnum, and posteriorly squamous part of the occipital bone. On each side there is condylar part of the occipital bone. Okay, condylar part of the occipital bone, then posterior surface of the petrous part of the temporal bone, and mastoid process of the temporal bone and mastoid angle of the parietal bone. Now, what are the other features of the posterior cranial fossa? Now, on the petrous part of the temporal bone, there is internal acoustic meatus. On petrous part of the temporal bone, there is internal acoustic meatus, which is closed laterally by lamina cribrosa, which separates it from the internal ear. On the mastoid part of the temporal bone, the mastoid foramen opens into the part of the sigmoid sulcus. Okay. Now, it supports the hindbrain, which consists of cerebellum, pons, and medulla. The subarcuate fossa supports the flocculus of the cerebellum. Now, what is the clinical importance? Fracture to the posterior cranial fossa causes bruising over the mastoid region and extending down over to the sternocleidomastoid muscle. This is important. Just remember. Now, the cranial nerves. Now, this cranial nerves, first nerve, then foramen where it is opening, and in which cranial fossa. Now, first nerve is the olfactory nerve. Olfactory nerve opens in the lamina cribrosa of the ethmoid bone. Olfactory, which is sensory, opens into the lamina cribrosa of the ethmoid bone, which is into the anterior fossa. In anterior fossa, this is the only one nerve: olfactory nerve, sensory nerve, which is of the nose, lamina cribrosa of the ethmoid bone, which is in the anterior fossa. Now, next is in the middle cranial fossa. In the middle cranial fossa, the nerves from second to sixth nerve. From second nerve to the sixth nerve, it comes under the middle cranial fossa. Now, which are those? Second nerve, which is optic nerve, which opens into the canalis opticus, which is in the middle cranial fossa. Next is the third, fourth, fifth, and sixth. In fifth also, only V1, the first V1, which is ophthalmic. The third, fourth, V1 and sixth nerve, it opens in the supraorbital fissure. The V1, it is in supraorbital fissure. V2, which is maxillary, it is in foramen rotundum. V3, mandibular, which is in foramen ovale. These are the nerves which opens in the middle cranial fossa. Optic nerve, oculomotor, trochlear, trigeminal also three. There are V1, V2, V3, ophthalmic, maxillary, mandible. Ophthalmic opens into the superior orbital fissure, maxillary in foramen rotundum, mandible in the foramen ovale. And sixth is abducent, which is in superior orbital fissure. Now, next is the posterior cranial fossa. In this posterior cranial fossa, from the facial nerve to the hypoglossal nerve, from 7th to the 12th, 7th and 8th, 7th and 8th nerve, it opens into the internal acoustic meatus. 9th, 10th and 11th into the foramen jugulare, and 12th nerve in canalis hypoglossy. Now these are all the cranial nerves from 1st to 12th. Again I will repeat. First, olfactory sensory, which is in the anterior fossa, opens into the lamina cribrosa of the ethmoid bone. Second is the optic nerve sensory, which is opens into the canalis opticus. Third, fourth, V1 and sixth in the superior orbital fissure. Maxillary V2, which is in foramen rotundum. V3 in mandibular, which is mandibular nerve, opens into the foramen ovale. In the posterior cranial fossa, 7th and 8th internal acoustic meatus, 9th, 10th, 11th foramen jugulare, and 12th in canalis hypoglossy. Now next is the localization of the vessels in the cranial basis. Now in the cranial fossa, anterior, middle and posterior cranial fossa, which are the foramen and which are the vessels which are passing through this foramen. Now into the anterior cranial fossa, there are three foramen. Foramen cecum, anterior and posterior ethmoidal foramen. In foramen cecum, the emissary vein to suprasagittal sinus. Emissary vein to the superior sagittal sinus. It comes and goes through foramen cecum. Anterior and posterior ethmoidal foramen, anterior and posterior ethmoidal artery, vein and nerves, it passes. Now only these two are there in anterior cranial fossa, foramen cecum, anterior posterior ethmoidal foramen. In middle cranial fossa, the canalis opticus. Through this canalis opticus, ophthalmic artery passes. Foramen ovale, there is ascending meningeal artery, accessory meningeal artery, and foramen spinosum, there is middle meningeal artery and vein. Foramen lacerum, internal carotid artery, it is important just to remember foramen lacerum, internal carotid artery. Groove or hiatus of the greater petrosal nerve, which is from this petrous branch of middle meningeal artery, it passes from this, and superior orbital fissure, superior ophthalmic vein, and from canalis caroticus, internal carotid artery. Remember, internal carotid artery, it passes from the middle cranial fossa. From the middle cranial fossa, it passes through two openings. First is canal caroticus and foramen lacerum. Don't confuse between foramen spinosum and foramen lacerum. From foramen lacerum, internal carotid artery. Foramen spinosum, middle meningeal artery and veins. In the posterior cranial fossa, the biggest opening, foramen magnum. From there, what are the structures passes? Medulla oblongata, meninges, vertebral artery, meningeal branch of the vertebral artery. Next is foramen jugulare. From this, inferior petrosal sinus, sigmoid sinus, posterior meningeal artery, and next is condylar canal. From this condylar canal, there are emissary veins. Foramen mastoidium. From this foramen mastoidium, mastoid emissary vein and occipital artery passes. And internal acoustic meatus, labyrinth artery passes. Now next is the blood supply to the brain. It is very important topic, blood supply to the brain, because the important structure, it comes under this, which is Willis circle, circle of Willis. Now this circle of Willis, it is formed by two main arteries, which is internal carotid artery and vertebral artery. Now this internal carotid artery, it gives anterior cerebral artery, middle cerebral artery and posterior communicating artery. Okay. And this vertebral artery, it gives posterior inferior cerebral artery, posterior inferior cerebral artery, basilar artery and posterior cerebral artery. From this, due to internal carotid artery and vertebral artery, there is a communicating circle of arteries which is formed in the brain, which is all called as circle of Willis. Now there are another arteries. Now you should know about this arteries, where it is located, where it is, like which structure it supplies. Now next is the sulci, gyra and lobes of the brain. The cerebrum, it folds into gyri which separates each other by the sulcus. Now this it is there to increase the surface area. Now on the superior lateral surface there are three main sulcus, which is central sulcus. See, there is central sulcus, lateral sulcus. Lateral sulcus is also called as Sylvian sulcus, and parieto-occipital sulcus. Okay, these are the main sulcus of superior lateral surface of the brain. Now there are several lobes which are distinguished. Frontal lobe. Now frontal lobe is divided into following gyri, and by gyri there are precentral gyrus, superior frontal and inferior frontal gyrus. See, inferior frontal gyrus, middle frontal gyrus, superior frontal gyrus. Now this inferior frontal gyrus, here it is again divided into pars opercularis, pars triangularis, pars orbitalis. Now in the frontal lobe there are three gyrus: precentral, gyrus precentralis, gyrus frontalis superior and gyrus frontalis inferior. And this gyrus frontalis inferior is divided into pars opercularis, pars triangularis and pars orbitalis. The parietal lobe, it is divided into following gyri by postcentral gyrus, precentral gyrus, gyrus postcentralis, lobus parietalis superior, which has two parts: gyrus supramarginalis and angular gyrus. The temporal lobe is divided into following gyri: superior temporal gyrus, middle temporal gyrus, inferior temporal gyrus. And the occipital lobes has transverse occipitalis and superior occipital gyri, middle and inferior, and also called as calcaneus sulcus. So these are all gyrus and sulcus of the brain. Now next we move on to the face, topography of the lateral region of the face. Now in this topography of the lateral region of the face, there is a superior lateral region which is divided into cheek region and parotid masseteric region. There are two facial region, like superficial and deep. Superficial is divided into cheek region and parotid masseteric region. Now landmark of this lateral region of the face is zygomatic bone and arc and lateral margin of the eye of the socket. The borders are superiorly zygomatic arc and inferior margin of the eye socket. Inferiorly is inferior margin of the mandible. Anteriorly there is nasolabial fold, nasobuccal fold and commissure of the lip, and posteriorly there is mastoid process. These are the borders of the lateral region of the face. Now topography of the cheek region. What are the borders? The superiorly it is infraorbital region, inferiorly inferior margin of the mandible, medially nasobuccal and nasolabial folds, and laterally anterior margin of the masseter muscle. Now skin. Layers. First is skin. It is thin, sweat and sebaceous glands are there, which is connected to the subcutaneous tissue. Now nerve is infraorbital, buccal and mental nerve. Subcutaneous tissue is thick and well developed, and superficial fascia covers the parotid duct, and nerves and neurovascular bundles. Just remember this: superficial fascia of the cheek covers the parotid duct. It also covers the Bichard's body, which is between the buccinator and masseter muscle, and it has three processes: ophthalmic, temporal, and pterygopalantine. Now next is the deep fascia, which covers the muscle, especially buccinator muscle, and also known as buccopharyngeal fascia. This deep fascia is also known as buccopharyngeal fascia. In the muscles, there are types of muscles like mimic muscles. Now why it is called as mimic muscles? Because the facial expressions of the humans, which is called as mimicry, this muscles helps into it, which are orbicularis oculi, zygomatic major, zygomatic minor, levator labii superioris muscle. Now another are buccinator muscle, which is covered internally by mucous membrane, and masseter muscle is also present. Now this buccinator muscle is pierced by parotid duct at the first upper molar. When we would study about the parotid gland, I would tell there about it. Now neurovascular bundles of this cheek region are facial artery. This facial artery, where does it lie? Subcutaneous tissue, and passes between mimic muscles and terminates at angular artery. Now branches of this facial artery: anastomosis with transverse facial artery and infraorbital artery. Now how the facial vein drains: facial angular vein and nasofrontal vein. It goes to superior ophthalmic vein, and from superior ophthalmic vein to cavernous sinus. This facial vein also anastomoses with pterygoid venous plexus. Now this facial nerve, we will study this facial nerve in detail further, but this facial nerve is mixed nerve. The motor branches to the deep layer of subcutaneous tissue and mimic muscles. The infraorbital neurovascular bundles. This infraorbital neurovascular bundles, it passes from infraorbital foramen. Now this infraorbital artery, which is inferior orbital fissure from the fossa canina. Infraorbital vein, it it flows through inferior ophthalmic vein and pterygoid venous plexus. Infraorbital nerve is a terminal branch of maxillary nerve, and it passes through infraorbital foramen, which innervates skin and mucous membrane of the upper lip, maxilla, and teeth from the upper roof. Now next is the mental neurovascular bundle. This mental neurovascular bundle passes through the mental foramen of the mandible, and mental nerve is a terminal branch of inferior alveolar nerve. This inferior alveolar nerve, it comes from mandible nerve of the trigeminal nerve. This mental nerve innervates skin and mucous membrane of the lower lip. Now mental artery is a branch of inferior alveolar artery, and vein, it flows to inferior alveolar vein. Now next comes the superficial part of the cheek, second part, which is the parotid masseteric region. Now this parotid masseteric region, anteriorly is the anterior margin of the masseter muscle. Okay, this is the masseter muscle. Anteriorly is the anterior margin of the masseter muscle. Inferiorly is the mandible base. Posteriorly is the imaginary line drawn from the mandible angle to the apex of the mastoid process. And superiorly there is zygomatic arch. Now layers of this region. Skin, it is very thin and covered by hair in males and contains wet and sebaceous glands. Now nerve is auriculotemporal nerve, which is by mandibular nerve, and greater auricular nerve, which is by cervical plexus. Next is subcutaneous tissue. Subcutaneous tissue is thick and has anterior auricular lymph node. Superficial fascia is thin and it is not connected to any bone. Next is the deep fascia. which is also known as parotoid masseterica. Fascia parotoid masseterica. It is fixed to the zygomatic arc and inferior margin of the angle of mandible. Now this deep fascia forms covering for masseter muscles, which extends to the capsule of Bichard's body and also covers parotid gland superficially and penetrates this gland. Now there are superficial muscles and deep muscles. What are the superficial muscles? Masseter, medial pterygoid and sternocleidomastoid muscles. And deep muscles are posterior belly of digastric muscle. Now this deep fascia and neurovascular bundles around the parotid gland forms musculofacial space. Now this is also called as spatium parotidum. Spatium parotidum. Now there are weak places in this musculofacial spaces. Come again. Deep fascia and neurovascular bundles around the parotid gland forms. Around the parotid gland, this is deep fascia and neurovascular bundles. This forms musculofacial space. Now this musculofacial space, there are two weak places. First weak place and second weak place. First weak place is the superior. Superiorly, pus passes through this weak place to the external acoustic meatus. From this weak place of the superior region of this musculofacial space, superiorly, if the pus is there, it passes through this weak place to the external acoustic meatus. And the second weak place is the medial surface, on the medial surface, which is between the styloid process and internal pterygoid muscle to the pharyngeal space. Now what are the neurovascular bundles of this? Facial nerve. Facial nerve exists stylomastoid foramen into the capsule of parotid gland. Facial nerve exists from the stylomastoid foramen and which enters into the capsule of the parotid gland. Now this parotid gland, superficial and inferiorly. Superficially there is temporal, zygomatic and buccal, and inferiorly marginal, mandibular and cervical. Forms parotid plexus. See here in this diagram also it is given. As soon as it exits the stylomastoid foramen, it enters into the parotid gland and it is divided superior and inferior. Superiorly there is temporal branch, zygomatic and frontal branch, and inferiorly there is marginal, mandibular and cervical branch. Now the auriculotemporal nerve. Auriculotemporal nerve, it is a branch of mandibular nerve. Posterior surface of the parotid claps. It comes from the posterior surface of the parotid capsule and ascends vertically and anteriorly from external acoustic meatus to temporal region. Now branches of this parotid tissue, external acoustic meatus and tympanic membrane. Now next is the external jugular vein. External jugular vein, it passes through styloglossus, stylohyoid and stylopharyngeus muscle. Now this vein of the parotid gland, superficial temporal, middle temporal, deep temporal, maxillary and transverse facial. Now this veins, it flows into retromandibular vein, and this retromandibular vein, it comes and empties into external jugular vein. Now which all the veins from the face region, it comes into the external jugular vein? Parotid gland, superficial, middle and deep temporal, maxillary and transverse facialis. It comes into retromandibular vein and then empties into the external jugular vein. Now next is the topography of the deep facial region. The deep facial region, there is superiorly greater wings of the sphenoid bone, medially medial pterygoid muscle, anteriorly tuber maxillae and laterally ramus mandibulae. Now what are the structures? This deep facial region, it is very important. Why? I would tell you. In this, there are spaces, different spaces, which is very important. Why? because specific nerves are passing, and if there is any surgical process, any trauma, any injury, then which nerve would be damaged in the which space, it would tell about according to the spaces. Now first is the spatium temporopterygoidium. It is a deep region which is bound by temporalis muscle and lateral pterygoid muscle. Now this spatium temporopterygoidium, there is maxillary artery and pterygoid plexus. Next is spatium interpterygoidium. One is temporopterygoidium, another is interpterygoidium, which is between medial and lateral pterygoid muscle. Now, which are the nerves? Mandibular, auriculotemporal, buccal, lingual and inferior alveolar nerve. Next is interpterygoid fascia. Now this fascia is the external surface of medial pterygoid muscle. Now through this fascia, inferior alveolar artery, vein and nerve is passing. Now pay attention. The inferior alveolar artery, veins and nerves, it pierces through this fascia, but the lingual nerve is covered by this fascia. Therefore, when anesthesia is given to the mandibular foramen, the inferior alveolar nerve is affected, but not the lingual nerve, because inferior alveolar nerve, it pierces through this fascia, but the lingual nerve is covered by this interpterygoid fascia. Now next is the maxillary artery. Now maxillary artery, there are three branches. First branch, which passes along the lateral pterygoid muscle. Okay. Now from where this maxillary artery comes? It comes from the external carotid artery, which passes along the lateral pterygoid muscle and gives off many branches. It gives rise to superior branch, which is middle meningeal artery, which gives superior branch, which is middle meningeal artery, inferior branch, which is inferior alveolar artery, and at the beginning part and next part of this artery gives rise to the buccal artery. Buccal artery, second part of this maxillary artery. Anterior and posterior branches of the deep temporal artery, pterygoid artery and masseteric artery. Now the third part of this branch, terminal branch, it gives to infraorbital artery, sphenopalatine artery, pharyngeal artery, greater palatine artery and posterior superior alveolar artery. Now mandibular nerve. Mandibular nerve, it exists from the foramen ovale. Mandibular nerve, it exists from the foramen ovale. Now it is covered laterally by lateral pterygoid muscle, okay, and branches of inferior alveolar nerve. Now there are two divisions first of all of this mandibular nerve, which is anterior division and posterior division. This anterior division gives temporal branch, masseteric branch, nerve to lateral pterygoid, buccal branch, and posteriorly it gives inferior alveolar nerve, nerve to mylohyoid and lingual nerve. Now next is the maxillary nerve. Maxillary nerve is the second branch of the trigeminal nerve. Now this passes to the pterygopalatine ganglion. This trigeminal nerve passes to the pterygopalatine ganglion, which is located in the pterygopalatine fossa. Now the greater and lesser palatine nerves are the branch of this ganglion. Greater and lesser now this greater and lesser palatine nerves of the branch of the ganglion which innervates the hard and soft palate respectively. And there is a nasal branch which passes to the nasal cavity through the sphenopalatine foramen. This passes through sphenopalatine foramen. Now next is the facial nerve and its branches. Facial nerve is a mixed nerve which contains motor nuclei, sensory nuclei and parasympathetic nuclei. Motor nuclei, sensory nuclei and parasympathetic nuclei. Okay. Now this motor root is formed by axons of motor nuclei and innervates the facial expressions and the part of sublingual muscles. See, this is the motor nerve which is in green. I will change the color. This motor nerve, it comes through the geniculate ganglion, it comes down through the stylomastoid foramen, and then it is divided and supplies to posterior auricular nerve, stylohyoid muscle and posterior belly of digastric muscle and muscles of the facial expressions. Now, this muscles of the facial expressions, there are terminal branches of this motor nerve, which are temporal nerve, zygomatic, buccal, marginal mandibular and cervical. This supplies to the facial expressions or muscles of the facial expressions. Now the sensory root. The sensory root, it comes through this geniculate body. It comes down, which passes through the chorda tympani, and then it innervates to the lingual part, which is anterior 1/3 of the tongue and soft palate, and also submandibular and sublingual gland. Now in the petrous part of the temporal bone, the facial nerve passes through the facial canal and it gives off several branches. Now the first is lacrimatory nerve, which it passes through the geniculate ganglion, which further moves as a greater petrosal nerve, which comes and comes under the pterygopalantine ganglion and supplies to the lacrimal gland. Next is the nerve to the stapedius muscle. Now this nerve, it comes from spinal nerve of the fifth nerve. It comes through the geniculate ganglion, it comes down through the stylomastoid foramen and supplies to the external ear. This was a rough explanation of the facial nerve. Now we move on to the connections of the fatty spaces of the head. Now there is a connection between spatium temporopterygoideum and interpterygoideum. And also there are fatty spaces of temporalis muscle, buccal region, which is also called as Bichard's body, orifices on the cranial basis, pterygopalatine fossa and eye socket. Now next is the spatium parapharyngeal. Now this parapharyngeally, medially there is pharynx and laterally there is pterygoid muscle and parotid gland. This space is divided into anterior and posterior. This parapharyngeal space is divided into anterior and posterior and connects with the fatty spaces, which is cranial base and hyoid bone. Now, if there is inflammation or pus from the lower jaw and space of interpterygoideum, from the lower jaw, it spreads to space parapharyngeal and space parotoideum. Now, if there is pus formation through this pathway to space of parapharyngeal, then there is complaint of dysphagia and asphagia also. And if we divide this spatia parapharyngeal into anterior compartment and posterior compartment, if there is anterior compartment penetration of aponeurosis, stylopharyngia, and if this infection is spread to anterior mediastinum by spatium vasovenerum, in the posterior compartment, spread to posterior mediastinum along the esophagus, which is dangerous because of necrosis of internal carotid artery or sepsis of internal jugular vein. Now next is patium retropharyngeal, which is bound by pharynx and prevertebral fascia. Now this is formed from the 6th cervical vertebrae, and then it is divided into left and right. Now next is the topography of the parotid gland. Now this parotid gland is the largest salivary serous gland, which has 7 lobules. Parotid duct, external surface of the masseter muscles, 2 to 2.5 centimeter inferior from the zygomatic arch. It opens into the first and second upper molar teeth. Now there are 3 lines formed, which is ala nasi, angle of mouth, and external acoustic meatus. There are 2 weak places, which are pharyngeal processes and external acoustic meatus. Now function is digestion and secretory immunoglobulin A. Now what is the holotopy of this parotid gland? Projected to the parotid region. Scalotopy, second cervical vertebrae, external to the skull. Syntopy. Syntopy is the anteriorly is the masseter muscle and medial pterygoid muscle. Posteriorly, there is mastoid process and sternocleidomastoid muscle. Superficially, zygomatic arch, cartilage of external acoustic meatus, and posterior of temporomandibular joint. And inferiorly, posterior belly of digastric muscle. Medially to this parotid gland, there is masseter muscle, mastoid, and styloid process. Now what are the arteries of this? Artery is superior temporal artery, vein is retromandibular vein. There is lymph nodes of parotid lymph node, and nerve is sympathetic trunk and auriculotemporal nerve. Now there are fatty spaces of the face, superficial region, deep region, and parapharyngeal spaces. Superficially we have seen orbital space, parotid masseter, and Bichard's body, and fatty space of fossa canina, fatty space of floor of the oral cavity. And deep region, there is spatium temporo-pterygoideum, spatium interopterygoideum, and fatty space of pterygopalantine fossa. And parapharyngeal spaces, there are retropharyngeal space, anterior and posterior pharyngeal spaces, which we have seen already, all these fatty spaces of the face. So here we end the topic of the topography of the head and face. Next video would be on the operations of this head and face. So first watch this video, read the book, and then move on to the operations. Thank you.